Good morning or afternoon, depending upon where you are. I'm Dr. Joseph Bivens from Optimal Plastic Surgery here in Yorba Linda, California. Today we're going to embark upon questions pertaining to facelifting. How do I make you look and feel younger? Well, of course, you know everybody is going to be slightly different. A lot of it depends on the shape of the face, a round face versus an oval face versus a very angled face. The round face tends to maintain youthful appearances a lot longer than does the more angled face. Typically, when you do a facelift, it's believed that you're going to gain about, I'd say, 5 to 7 years of youthfulness after you've completed the facelift. I frequently tell patients that the most important thing about facial rejuvenation is maintenance. So you want to start very early on protecting your skin and face against the effects of the sun. When it comes to a surgical manipulation for the face, I would probably target between 45 to 50 to consider doing something to eliminate the excesses that you will see before the ears. And then a major facelift, I would probably suggest somewhere around the age of 50 and above for a major facelift. The facelift actually incorporates multiple parts of the face. I divide the face into thirds. The upper third from the forehead down to right between the eyes, from the eyes below the nose, and then from the nose down to the chin. That's typically the face. Now the neck is from the chin down to the collarbone. So when you're doing a full facelift, typically it does not involve the neck. However, there is an operation known as a neck lift that now focuses on the chin down to the collarbone, and that's typically a neck lift. Well, as I've mentioned before, managing the face and maintaining an appearance of youthfulness is a continuum. And I said between 45 and 50, one may consider having a mini facelift, and then after 50 or so, they can have a major facelift. So the response is yes, you can have more than one facelift, and in some instances it is to the benefit of the patient because it tends to reduce the severity of aging if they're going to embark upon the second facelift. The facelift will not restore volume to your cheeks because many patients, as they get older, they develop what's called lipoatrophy. That means your fatty tissue starts to diminish. The facelift is going to reposition the skin and tighten the muscles and the different layers of tissue beneath the skin. But when it comes to volume improvement, the best way to do that is to add some volume either through the use of fat or hyaluronic acids or some of the other volume additives that we have produced today. Thank you very much for participating in our questions and answer session. We are located in Yorba Linda, California. If you have any additional questions of any type, please feel free to write and give us your questions, and I'll be more than happy to respond.